for me personally, I joined PNHP because I heard a talk based on PNHP's data slides almost 20 years ago. And I heard it and I thought, man, wow, wait. And I raised my hand and said, have you told people about this? Because this is really something, right? Like, and it's really incredible that 20 years later, we're still seeing it and it's just getting worse. It's mind-boggling. And at some level, I think, man, is this just Sisyphean? Like, are we never going to get where we want to go? But then I think about the things that we have done over as an organization that have been some of our successes. And looking back over the last year, I think one of them is that our students have started 10 new SNAP chapters in this country. That's amazing, right? If our students are the future of this organization, of this activism, the fact that we are continuing to build out the single-payer presence with our goal of every medical school in this country, I think we're making great progress. We also published our Medicare Advantage Harms Report and had that webinar this last spring. And this was really a big deal, right? If you were able to see it, we had Senator Elizabeth Warren joining us for the webinar, but we talked about how much this system is hurting us and how much it's hurting our patients. And I think until we raise that so that everybody can hear it, this is the sort of thing that makes it personal, right? And I see this in my own family as I watch my family and my wife's family grappling with Medicare Advantage and, what it isn't covering and how much it's costing. It becomes personal for all of us, right? And these are the sorts of things that absolutely inspire us. But, one of the other things that we did, and we'll talk a little bit more about this later, is we struck a $22 billion blow to the insurance industry with some of our actions earlier this year. And so, this stuff is happening. I'm glad we're fighting it, because if we weren't, imagine how much worse it would be, right? And so we have to keep this fight up. And so as I've been thinking about PNHP's role in this movement, I think that we start with that foundation of research, but we need to do something with that, right? We need to move, we need to organize, we need to activate, we need to fight. And so I want to share with you the framework that we're thinking about for the organization moving forward. And so you've heard of, the triple aim, courtesy of Don Berwick, right? It's cost and quality and the patient experience. Well, PNHP's got a triple aim, right? And obviously, our true north is to get to a single-payer system, right? We all know that that's why we're here. We're Physicians for a National Health Program. But in addition to that triple aim, we've got two additional, I think, absolutely critical ones. We want to end profiteering, and we want to improve traditional Medicare. Now, just to be 100% clear about what I mean here, when I say end profiteering, we're talking about Medicare Advantage, which is the finest example of government-subsidized profiteering, right? It's crazy. So obviously, we are targeting Medicare Advantage, and we're going to hear a little bit more about that in just a second. But we're also targeting traditional Medicare. We need to make it better, right? We know when we talk to doctors, we know Medicare is accepted at over 90% of physician clinics. So it's widely accepted. And yet, if you say to doctors, well, we want to have Medicare for all, and I say, well, I don't want to have a Medicare for all system because Medicare is imperfect, right? Medicare doesn't cover everything. It doesn't cover hearing, doesn't cover vision, doesn't cover dental, doesn't cover long-term care. It has these out-of-pocket maxes that are so high that you got to get additional insurance on top of your Medicare insurance just to be able to pay for your care. And so these are the kinds of things that we are also targeting with a specific emphasis on this out-of-pocket max. And we'll hear a little bit more about that, but the idea is if you didn't have a high out-of-pocket max, you wouldn't have to buy additional insurance. Traditional Medicare would simply be covering and protecting you from financial risk, from financial instability. And so Our triple aim is really that these are the things that we're going to be fighting for, because ending profiteering and improving traditional Medicare are absolutely critical to us getting to a single-payer system. Because let's think about this, right? If we don't end profiteering, if we see the rise, the expansion of Medicare Advantage everywhere, they're never going to give that up, right? The private insurance companies are going to say, don't you dare take away our ability to profit off of the government. So the more that Medicare Advantage grows, the harder it's going to be for us to claw that back and get the single-payer system that we need. And in conjunction with that, we need our traditional Medicare system to be the system that we want it to be. You know, we've talked for years. This isn't just expanded Medicare for all. This is improved and expanded Medicare for all. We don't have to wait to get Medicare for all to make Medicare better, right? There are so many things that we can do to make that program better, to set ourselves up for success when we want to expand that to everyone. And so in thinking about this, I think that truly these two pieces of this triple aim are critical for us to get to the single-payer system that we want. But there's barriers, right? There's a wall that keeps us from being able to get to this system. And how do we break through this? How do we continue to use these tools to break through and get us to a single-payer system? We need to build power. And building power isn't something that physicians talk about. What do physicians say? We just want to take care of the patients, right? We don't want to talk about organizing. Who's Saul Alinsky? I don't want to read, we're here in Chicago, right? I don't want to read rules for radicals, but this is what we need. We need to build power if we have any hope of breaking through this wall and getting to the single-payer system that we want. And so, how do we build power? We grow our members, right? We're at 25,000 now, but there's 1 million doctors in this country. Why in the world, if the majority of physicians support single payer, do we not have 500,000 members, right? This is the work that we need to do. We need to fundraise. Again, we don't want to talk about fundraising. Why are we NPR? We're not out there trying to, pledge drives and all of this. But we need to get engaged in this kind of work, because it is with the resources that we get that we are able to expand. I don't know if you know, but 10 years ago, 12 years ago, when I started with the organization, we didn't even have an organizer. And now we've got 3, we've got 4, we've got a comm staff, we've got an amazing staff. But that's because we have the resources to pay them. Oh, and let's not forget that this year we are getting foundation grants to continue the work that we're doing. And we'll talk more about that, but this is a whole new thing for us as an organization, right? We're actually out there. Other organizations are giving us money, and that is helping us do this good work that we need to do. This is just the beginning, but that is allowing us to make a bigger impact. What else? How else can we do? Legislative relationships. Wait, who's coming tonight? Oh, Congresswoman Jayapal's coming tonight. This is fantastic, right? This is indicating that not only does she support this, as she has introduced the Medicare for All bill now since 2017, she believes enough to get on an airplane, fly the heck out here, spend some time with us, and help build this relationship, help us understand what we need to do to get there. So this is an unprecedented amount of power that we are building, but we need to keep doing this, right? She is one congressperson. There's so many more out there that we need to convince of this. And then, of course, advocacy alliances. And the work there was a question asked about the nurses. It's not just the nurses. There's so many organizations now that have risen up in support of a single-payer universal health care system. And we are leading. We are partnering. We are working with all of those organizations, because that's what power is about, right? And so this is how we break through that wall and ultimately get us where we want to go. Oh, shit, what happened? The wall got bigger, because what this election has given us, right? The election has given us an even bigger barrier, and so we need even more power, right? And that's maybe the lesson of all of this, is that if we want to get there, we have now an even bigger wall to fight, so we have even more power that we need to build. And so as you're going out, thinking about, what am I going to do this year? How am I going to get through all of this? One of the points of this meeting is for us to give you the tools to build this kind of power. Now, this power is allowing us to boldly go where we've never gone before. I appreciate, for those of you that, there's probably a couple of you that recognize this reference, but ultimately, I want to drive this point home that, like, ending profiteering, man, everybody likes that, right? Everybody can see how terrible it is, that the corruption that we baked into this system, it's actually making things so much worse, right? But one of the things that we're doing now this year, we've got this, we've received a grant to actually study moral injury. And you're like, what is moral injury? This is that sense when physicians go to work and then they watch their patients suffer because, when they're doing the right thing, all of a sudden the patients are going to have more copays because of the way that this coding system works. Or they're getting pressured to upcode, right? Or they're watching, I can remember this, right? When I was working in the ICU here in Chicago, we would routinely have patients admitted with diabetic ketoacidosis. Why? Because they just couldn't afford their insulin anymore. Or maybe that insulin that was good for them was no longer on the formulary, and so they're just going without. Or asthmatics coming in status asthmaticus because they can't get albuterol anymore because, of course, with all the craziness that happened in pharmaceuticals, the price of albuterol went from pennies to dollars and dollars, right? So you're literally seeing patients suffer, and that makes us feel pretty crappy. And that's where this moral injury comes into play. And so we've actually gotten a grant to study this. And so the survey that we're encouraging everybody to take can be found at this link here. But really, this is an organizing tool for us because you don't have to be a single payer supporter to fill out this survey. You just need to be somebody who takes care of patients. And so we want you to get this out to everybody that you know, because the bigger our N, then the more power we have. And I mean that, in terms of statistical power, right? The more responses that we get, the more that we can do with this data to prove to people that doctors are suffering, right? And as we suffer, you see people leaving. You see people burning out. You see people choosing non-clinical jobs. And obviously, this is disastrous for our healthcare system. So, that's one place where we're engaging in the work this year. The next is this idea of improving traditional Medicare. It's interesting, but not everybody that supports traditional Medicare is actually aligned with our goal of single payer for everyone. But I would make the argument that improving traditional Medicare is also the best way to defend it, right? Because what we don't want to see is the erosion of traditional Medicare. Because remember, one of the things in that Project 2025 document is, let's just get everybody into Medicare Advantage plans. Like, can you imagine, right? And we'll talk a little bit more about the implications of that. But we have engaged in work with legislative offices to actually get legislation to do just this, create a maximum to out-of-pocket expenses for patients. They're not going to have to buy these supplemental products anymore because suddenly the insurance that they have is going to protect them from risk. Now, does that mean it's going to cover hearing, vision, dental? No, we're one thing at a time, right? But we're looking at ways that we can shore up traditional Medicare, and that's also been a real cornerstone of the work that we've been engaged in. And obviously our true north, right? Single payer. This is going to be the other place that we continue to work. So you're going to see us talking about different fronts, right? We're going to be fighting on the ending profiteering front. We're going to be fighting on the improving traditional Medicare front. But we're always going to be committed to the single payer front. And that means engaging with Congresswoman Jayapal. We're going to make sure that that bill continues to get introduced. We're going to continue to organize around that and get people on board. We know it's not going to pass in the next 4 years, but that doesn't matter. Now is the time for us to build power so that when we have the opportunity, we will be able to get this across the finish line. So, ultimately, that's the work we're doing. Now, building more power, obviously, that's the start, but that's not the end, right? And again, this is what you're getting out of this meeting. We've got plenaries, we've got panels, we've got campaign workshops, skills building workshops, and our board is meeting tomorrow. We are going to be reflecting on all of the things that we learn from you about these fights to help guide how we're going to be moving forward. So I think I want to just wind it up with all of the allies that we've been working with. And so in this last year, we have built so many good relationships. We are literally on regular communication Zoom calls with members of all of these organizations because they all care about this too. And we're out there as the single issue organization leading this fight. So these are our partners. These are people that we are talking to actively. And they're your allies too. So, as you get out into your local chapters and your local activism, show up for them. When they are organizing, you show up for them because they will turn around and show up for us as well. And so, honestly, this is what building power looks like. This is what organizing looks like. It's been great that for so many years we've spent, PNHP has been the source of truth, the source of research, that we have given these, amazing Grand Rounds, educational conferences. It's time to get it out of the Grand Rounds auditorium. It's time for us to get it out on the streets. It's time for us to get it into legislators' offices. It's time for us to really connect to all of these partners and realize that we all have a shared goal and work together.